Hi everyone, thanks for listening to my presentations. Today I'll be talking about Cauda Equina syndrome. Cauda Equina syndrome. Okay, let's go. Cauda Equina means horse tail. Horse tail. When it comes to Cauda Equina syndrome, the brief anatomy is essentially that spinal cord passes through the vertebral column, and specifically lumbar sacral nerve roots will be covered, and Cauda equina is the bundle of nerves at the end of the spinal cord. It is at the lowermost part in the sacral region, and the Cauda equina is also known as horse tail. When it comes to clinical features, Cauda equina syndrome is a surgical emergency affecting all the perineal region, including the external genitalia and the anus. Still part of the possible clinical features will be cerebral anesthesia. In that case, it's going to be affecting the area in contact with the saddle while riding a horse. Then the sensation could be that of pins and needles at the perineum. Also, it's possible to have numbness, and the individual may not feel pain, that is, loss of pain. Also, we might be having severe low back pain, sciatica, paraplegia, fecal incontinence, or urinary incontinence. In males, there's likelihood of erectile dysfunction, decrease or absent reflexes, and the individual may be falling down more frequently with probability of having apprehension and becoming depressed. The etiology or causes is essentially that the sciatic nerve will be affected, and that will cover L4, L5, S1, S2, S3, and S4. The Cauda equina will span L1 to 5 and S1 to 5. The causes will also include trauma, for example, road traffic accident or compression fracture, ballistic trauma, or iatrogenic, particularly from lumbar puncture. Can be as a result of lumbar spinal stenosis, ankylosing spondylitis. You can check my video for a full presentation on ankylosing spondylitis. Might be as a result of Paget's disease. Might be secondary to rheumatoid arthritis, osteoarthritis, tuberculosis of the spine, otherwise known as Pulse disease, obesity, heavy lifting, or pregnancy. Diagnosis. Diagnosis should include thorough history. For example, history of pulmonary tuberculosis that has now become disseminated tuberculosis will be helpful. History of trauma and so on. Okay. Then we have complete physical examination done. If MRI is available, that would be very great, and have it done quickly. CT scan could be done. Ultrasound to scan the bladder because there's possibility of urinary incontinence. Treatment is an emergency surgical procedure. Laminectomy could be done to decompress. So emergency surgical intervention for decompression. Laminectomy could be embarked upon immediately. So consult to the surgeon quickly. Can give analgesics. Now, of course, the patient will not even appreciate your effort without relieving the pain. Antibiotics could be administered if you sense abscess, and of course, incision and drainage in any case of abscess. Excision of tumor if it's present, and you can administer your steroid if you notice inflammatory process that is already identified. Lifestyle changes if you're dealing with obesity, curtail exercise, early intervention will prevent long-term damage. The key here is early detection and a quick intervention. And with that, I've come to the end of this short presentation. known as Cauda Equina syndrome. The most important thing is identifying the diagnosis quickly and calling the surgeon for immediate decompression. Thanks for listening. Please remember to share and subscribe. I appreciate it.